Assalamu alaikum. My name is Dr. Khurram, and today the topic that I would be presenting is extensive sialolithiasis giving a beaded stone appearance. It is a report of a rare case. First of all, I'm so sorry that I couldn't join you in person at the second International Radiology Conference of Ministry of Health and Population organized by the General Department of Radiology in partnership with Egyptian Society of Radiology and Nuclear Medicine. Because of some of my visa issues, I couldn't join you people. So I'm today presenting my case live here. So this case is a very rare presentation that we encountered while performing a CT scan of a young adult. I'm currently working as a resident radiologist at Shifa International Hospital, Islamabad. That is basically a JCI accredited hospital of Pakistan and one of the most renowned institute of radiology based setup in which we have all of the state of the art facilities under one roof. My co-authors in this presentation are my fellow Dr. Amna Mehboob as well as my consultant radiologist Dr. Samina Akhtar, which have affiliation of the same hospital. So coming on to my next slide, we have actually no conflict of interest in presenting this case report, and we have no funding rule to declare. Secondly, all authors contributed equally to the drafting of study, and this submission has not previously published or is under consideration for publication in any journal. The patient signed an agreement informed consent form as per the ethical guidelines, and we have its official RV as well. So what are the aims and objective? What are the things that we need to discuss today in our presentation? As let's go back and start from the basics. What exactly is sialolithiasis? Sialolithiasis refers to the formation of calculi that we usually call it as sialoliths inside the ducts or the parenchyma of the salivary gland, and most commonly it involves the submandibular gland and their ducts. So it is most common in around 50% of the salivary glands pathologies, and the most common involved gland when the pathology is encountered is basically this submandibular gland. So presenting the clinical presentation, the patients usually present with pain within the involved region, as well as they're associated with eating due to non-obstruction of the draining duct like submandibular duct, that is also called as the Wharton's duct. And then most of the people go for the imaging like radiographs or sialography or ultrasound or CT or even MR can be done. So if I present my case today, the main objective of my today's presentation is to present a rare case of this extensive sialolithiasis that usually gives a beaded stone appearance. So basically it is the formation of calculi in salivary glands or duct, as I totally said you before, and commonly involve the adult age. Submandibular gland is mostly affected with prediction of ductal involvement as compared to the parenchyma. And we report this rare case of 54 years old male non-diabetic presented with pain and swelling in the right submandibular region for the last 3 months. He usually ignored this thing and then presented to our ENT department. ENT department urgently referred that patient for the CT neck with contrast, and that was performed. CT showed multiple calculi giving a beaded appearance in Wharton's duct with areas of narrowing and dilatation. The right submandibular gland appeared also bulky and enlarged, and with surrounding strandy changes representing evolving or early sialodenitis. This is a very seldom presentation of extensive involvement of Wharton duct giving a beaded stony appearance. This is not frequently seen. That we usually see that there is a small calculus or there's ongoing sialodenitis. This is a very rare presentation, and the imaging findings that I'm going to show you is what makes it special to present here. So if you can see this image, this is a CT contrast enhanced image at the level of submandibular glands, in which we can see this extensive stones and calculi almost involving whole of the right-sided Wharton's duct, and this is basically the rare thing that we saw, that even if the patient is ongoing sialolithiasis on the right side, the whole of the Wharton duct is involved by the extensive calculus, and this is giving appearance that is we call it as a beaded appearance. If you can see it clearly on the presentation, it's a very beautiful image of this extensive sialolithiasis, and this is also seen on the images of coronal and sagittal. This extensive hall of the Wharton ducts is dilated with extensive calculi, and so this patient was then referred, and however this patient lost to follow-up. Otherwise I would have shown the post-op images as well. Unfortunately, in a country like Pakistan, we usually lost the patient to follow-up because of their financial and economic status. Otherwise this was a very rare presentation, so that was I wanted to share with you people. Hopefully you would have liked the case. And as I mentioned before, that these are the multiple calculi giving beaded appearance of Wharton ducts, with calculus also seen the submental gland with changes of ongoing sialolithiasis. So this was a very rare case, and I hope you would like this presentation. In case I'm so sorry that I couldn't join you in person, that was due to my visa issues, and otherwise I would love to join you people there in person. However, for any questions, these are my Twitter and Yahoo and Insta handles links. You can comment or mail me. I'll be happy to reply back. Hopefully you will like this presentation. I'm up for any questions. Thank you so much.